jealous, isn't it? And there's two or three varieties. You have oils.
There are many.
There are many varieties.
There are about 100 varieties. And since 1960, stronger version of Cheras has come into market.
And more concentrated variety.
More concentrated, more stronger than before.
All right.
And today's Cheras cannot be compared with Cheras of 50 years ago. It's about 100 times stronger than that, and it can cause psychosis. In 10% people, it causes psychosis.
I mean, what can the family do? What can parents do?
Once that's happened.
And what can perhaps schools or educational institutions do to deal with this problem?
Educational institutions can train their teachers who could communicate this message in class in a normal way, not in a very, very alarming way. They can always give this message along with other educational messages, but when the tragedy has already happened and a family is already suffering from the addiction of a family member, they must first go through some counseling, and they should get some education about drug addiction and then talk to the person. They should not jump to the conclusions. They should not slap them, they should not nag them, they should not cover them.
Ostracize them.
Yeah, nothing like that. You just go to a doctor, you just go to a counselor, a psychologist.
What is the first reaction that people have?
You see, the person suffering from addiction or alcoholism, first of all, he is going through denial. And then family gets this denial too, because it is too overwhelming to accept that a family member as an addict. So the family goes into denial. And as they say, the fish discovers water lost. So the person suffering from this addiction discovers last that he is suffering from a real problem.
But what does the individual actually experience physically and psychologically within themselves as they go through this withdrawal process?
It is what they do at their home. They try to quit, they try to reduce the amount of drug they have been using. And what happens is that they go through a lot of aches and pains and common cold symptoms. This is what we call as cold turkey. So they are suddenly amazed and surprised by this, and then they go back to using in the same manner. So repeated failures at home give them.
Cut you short there. We'll have to go on a break. However, after the break, we'll be coming back and discussing more intervention and more treatment related aspects of alcoholism. Please don't go anywhere. We'll be right back.
I learned some things today. Even as a parent, I thought I knew it all about drugs, so I've done this with my kids, but this was an eye-opener. Thank you very much.
Thank you for having me on show.
We need to take a break now, but you need to stick around because